Good morning, good afternoon, and good evening, everyone. I'm so happy that all of you are here for today's session. Welcome. Okay. Ladies and gentlemen, esteemed participants, and distinguished guests, good morning, good afternoon, and good evening to all of you. My name is Saili Joshi, and I'm the Senior Learning Facilitator with Uni Athena. I'm thrilled to welcome each and every one of you for today's session, Zero Malaria Target. Today, we gather in a virtual space to address a significant triumph in global health, a remarkable 88% reduction in malaria deaths over the past 2 decades. The strides made in combating the devastating illness reflect the dedication and collaborative efforts of health organizations worldwide. As we embark on this webinar today, we recognize the need for a fresh vision and new talent to further advance the fight against malaria. Uni Athena is proud to host an event that not only highlights the progress achieved, but also seeks to inspire and mobilize individuals to join the global efforts against this persistent threat to public health. Throughout our session, we will delve into intricate landscape of malaria elimination, discussing the challenges ahead, the strategies employed, and the interventions that have contributed to the substantial reduction in malaria-related fatalities. Moreover, our distinguished panel will shed light on the pivotal role of global healthcare leadership and systems in shaping the trajectory toward a malaria-free world. Today, we have Ms. Rachel Omaha, a research fellow from the Center of Transdisciplinary Research in Malaria and Neglected Tropical Disease from the University of Lagos, Nigeria. I welcome her and I encourage all of you to actively engage in today's discussion, pose questions, and foster a collaborative exchange of ideas. We will be having a question and answer session at the end of the webinar. There is no fees for the certificate, so all of you are encouraged to have many questions. Please continue, join the session and be interactive throughout. Let us start this session with an icebreaker question. I would like to ask all of you if you can tell me how old is malaria. You can post your answers in the chat box. How old is malaria? Is it about 30,000 years old? Or maybe 300,000? Maybe 3 million years? Or 30 million years? What do you think? Rachel will be having her answers and I'll soon hand over the session to you.
Okay, thank you.
Okay, so we are having number of answers. Some are claiming 30,000, some are claiming 3 million, some are claiming 30,000 years. Okay. That's a good response, people. Okay. A, some are saying B. Okay. Great, great. Okay. Thank you for the overwhelming response. I would like to answer the correct answer for this question is D. That is about 30 million years old. Now moving on to the next question. The next question is all of you can answer the in the text chat box. Malaria can spread via the following routes except if it's blood transfusion and organ transplant, bite of infected female Anopheles mosquito, use of contaminated needles or syringes, or is it food, water, or airborne transmission? I would request all the attendees not to type the whole answer, but you can just say A, B, C, or D. I think that's much easier for all of you. Okay, so we are getting good responses over here. Okay, this is a little tricky question. So some are saying, okay, I'm getting most of the answers as D. Okay, great. Again, thank you for an overwhelming response. The correct answer for this question is D again. So thank you so much, all of you. And I would like to hand over the session to Rachel. Rachel?
Hi, Sahili. I can hear you.
Yeah.
Thank you so much. Thank you so much for the introductions and for our icebreaker question. Thank you very much. And a very warm welcome to every one of us attending this webinar today. Thank you so much for coming. I appreciate your being here. I hope we will all have a fulfilling session. For me, I am particularly happy and excited because this opportunity is my very first time as a panelist. I feel like it's a special occasion for me, and I thank Uni Atina for this great opportunity, this great impact in my career development. Thank you so much. So my name is Dr. Rachel Omaha, and my presentation aims to highlight the importance of strengthening the various health systems and leadership tasked with achieving WHO's zero malaria target in endemic countries. So I have outlined an agenda to guide my presentation. In a nutshell, I'm going to be talking about the progress achieved so far on the journey towards WHO's zero malaria target. Then we'll talk about some of the challenges that are being addressed with various strategies and various interventions, all aimed at achieving this global target. Then we'll highlight some of the importance of strengthening the health systems, the importance of scaling up some of the malaria leadership, scaling up the malaria leadership for our elimination goals. So we'll go straight to the introduction now. Malaria is one of the most severe public health problems. It is a parasitic disease and is endemic in most of the resource-poor countries. And there it poses a lot of challenges to the country's developmental efforts. So in the next slide, we'll try and discuss some of the points, how malaria is a public health challenge and how it affects the developmental challenge, the developmental efforts of these countries. So first of all, the major problem is the female Anopheles mosquitoes that transmit this disease, malaria. The Anopheles mosquito is a very efficient transmitter of this disease. Is a very efficient, is very efficient, and then that makes it of a public interest, of public health interest, and then it transmits the parasites to humans when it bites in an attempt to feed on blood meal that it actually needs for its development. Now, malaria is also a very common disease because of this efficiency of these mosquitoes. And then it's very common and it affects up to half of the world's population, which is about over 1 billion people who are now at risk of the disease. Malaria is a huge burden, especially in the sub-Saharan African countries, where about 9 countries in the sub-Saharan region account for up to 95% of the global malaria cases we have now. Malaria cases are mild. They can be mild and they can resolve very, very quickly, especially when treated timely. But then again, malaria can get very complicated very easily and then lead to life-threatening symptoms and then eventually death. So some of the complications that are very fatal can be seizures and coma. It can be in form of damage to the vital organs like the kidney, vital organs like the liver, the spleen. Then malaria can very commonly cause anemia. any of these conditions, any of these symptoms are severe and they can easily be life-threatening if not well managed immediately. So malaria is a leading cause of death, especially in pregnant women and in children under the age of 5. These groups, the children and the pregnant women, are the vulnerable. They are the most vulnerable group because they have very little or no immunity against the disease. So they have more cases. We see more cases in them. We see more deaths occurring in them, in these groups. So the primary healthcare plays a very important role to manage these cases, and therefore strengthening the health system will particularly benefit these groups to improve their access to life-saving anti-malarials. So in the next slide, I'll talk a little bit about how malaria poses very significant cost to both individuals and the governments that are affected by the disease. So people that are directly affected by malaria, they have to deal with a lot of costs coming in the form of the cost for buying drugs, the cost for accessing healthcare, the cost for buying or assessing the preventive measures that are in place. Then they suffer all these consequences in addition to the problems from not being unable to go to work because of malaria, then the children being absent from school until they recover because of malaria. And all of these put together affects productivity for both the adults and both the children at school. Then malaria is also particularly, it also particularly poses a substantial cost because most often people in endemic regions, they experience more than one episode of malaria in a year. An individual may experience up to 2, maybe 3, maybe 4 episodes of malaria in a year. And each time an episode is suffered, you are incurring this cost, financial cost, and then productivity cost. You are incurring all these costs, and that is multiplied by the number of times you have malaria in a year. So it actually comes at a cost to both the individuals and their families. Then it also comes at a cost to the governments. The governments have to deal with the challenge of providing functional primary health care systems. They have to deal with the challenge of making sure that these health systems are equipped and they have the recommended interventions such as the insecticide-treated net, the artemisinin combination treatments, and now we have vaccines. So they have to also make efforts to see that the health systems, they have the vaccines too. So they have, and then not just providing these tools, they have to make sure that the health system have the capacity to deliver and to manage them. They have to be able to manage them. They have to be able to make sure that they can be able to have a wide coverage using these tools to make sure that their nations, their countries are adequately covered with these interventions so that they will be able to get desired results as expected. So it's a big challenge for them also as in the government who are affected by malaria. So malaria problem is quite a difficult one, and it causes a number of both direct and indirect impacts that only a universal eradication of the disease can actually fully address. Last year, the World Malaria Report by the WHO showed that, I'm going to the next slide now. The World Malaria Report showed that almost half of the global cases were accounted for by 4 countries. These countries are Nigeria, that accounted for the highest number of cases at about 27%. Then we have the Democratic Republic of the Congo, that contributed about 12% of the global case. Then we have Uganda, 5%, and we have Mozambique, 4%. So these are the categories. These countries are categorized as the high burden countries. They are the high burden countries, and we particularly now need to scale up interventions, to do a lot of follow-ups in order to achieve timely results for the global technical strategy zero malaria goals in these countries, in these high burden countries. Then in Nigeria and the Democratic Republic of the Congo and the Niger and the United Republic of Tanzania, we also had the highest number of deaths recorded in year 2023. So of all these countries, Nigeria was also the highest, that had a record number of about 31% mortality for malaria cases last year. This report emphasized the need to identify the challenges faced by these countries. We need to find out what is wrong, what are the challenges. We need to develop plans to overcome these challenges so that we can achieve our ultimate goals. So next slide now. The next slide, I think I've talked about this now. The next one. Yes, here on a global scale, malaria cases were estimated to be about 249 million cases. So we had the global number of cases was 249 million, and the global number of deaths recorded was 608,000. Well, this is still a lot of cases, it's still a lot of deaths we don't want, especially not now we have all these tools that continues to improve, that continues to prove to be effective. We have the artemisinin combination treatments that are really helping. We have the insecticide treated nets. We have the indoor residual spraying strategy. And now we have vaccines. So these numbers are still quite high with all these tools we have available now. And then also it's still high considering that we are drawing closer and closer to the timeline set to achieve malaria elimination worldwide. At this point, so close to the timelines, we need these numbers to be a lot less. We need these numbers to be a lot less. The target is zero cases, zero deaths. So we need to improve the health systems. We need effective program management and leadership that will help us to surmount whatever the challenges are and move closer to achieving these targets for zero malaria. Then on the next slide, yes. So the WHO's vision is for a world free of malaria. The WHO aims to achieve a world that is free of malaria. How it's going to do it? It's by interrupting the local transmission of mosquitoes. It plans to interrupt all the local transmission mosquitoes, and then in defined geographical area as a result of deliberate control activities. Using deliberate control activities to interrupt all the local transmissions caused by the female Anopheles mosquitoes in different geographical areas. The aim of this is to prevent all indigenous cases imported. Even though there may still be some imported cases being introduced, those numbers will over time become fewer and fewer, because as small countries eliminate malaria from their countries, from their regions, there will be no case to import into the neighboring countries anymore. So the aim is first to interrupt local transmission, and then irrespective of the imported case still coming in, that will not be an issue, because over time, elimination from all the countries will take care of that. So in a nutshell, each country has to eliminate all the 4 human parasite species: the Plasmodium falciparum, the Plasmodium vivax, the Plasmodium ovale, and the Plasmodium malariae. All the countries that are endemic for malaria have to eliminate these species. So the next slide. Okay, thank you. Overall, the successfully eliminating malaria and achieving zero target is going to be a long-term process. It's going to be a long-term process, and it's going to involve eliminating malaria from each endemic country. First, we are going to eliminate malaria from each country where it's endemic, and then we're going to eliminate at the regional levels, and then ultimately, we're going to eliminate at the global level and eradicate malaria. And then the WHO global targets and strategy outline the timelines to achieve these elimination goals. It has outlined the timelines to achieve these elimination goals. And from this table, we can see that the strategy aims to reduce malaria incidences and mortality, and ultimately eliminate malaria and begin preventing re-establishment by the year 2030. Okay, this strategy was updated in year 2021, but I use this table because I wanted to highlight the two of the 2020 milestones that were achieved. WHO achieved two of the milestones set for 2020. The targets for number of cases and deaths were missed though. Malaria was eliminated in 10 countries. And then establishment is now ongoing. Prevention of establishment is now ongoing. So malaria should not be reestablished in those 10, about 10 countries where malaria was eliminated. So it achieved two of the milestones, and then the number of cases and deaths were missed. That was mostly because of the disruptions from the pandemic, though. That really contributed to why those two other milestones about the cases and the number of deaths were missed by a little window. So these results are quite encouraging. And then following the impact of the COVID-19 that disrupted the interventions and all the malaria programs on ground, the global community has continued to scale up interventions. They have continued to scale up interventions so that we'll be able to achieve the other milestones and targets. There are 4 phases of malaria elimination. Okay, I think I need the next slide now to be able to explain this now. Next slide, please. Yes, there are 4 phases. No, the other one. Yes, this one. There are 4 phases of malaria elimination. There is the control phase, the pre-elimination phase, the elimination phase, and the prevention of introduction phase. This, as we can see on the continuum, shows that endemic countries are at different phases of this WHO elimination continuum. They are at different levels, at different points on this continuum. And this is because the rate of progress differs for each country. They are progressing at very different rates. But the major strategy being employed by all of these countries controlling malaria is about the same. They are majorly using chemotherapy, and they are majorly using vector control tools. So ultimately, we expect to be getting the desired results, even though the level of progress is not the same. Next slide, please. The Sustainable Development Goal for good health and well-being includes a specific objective. It includes a specific objective to eradicate life-threatening diseases, including malaria. So one of the objectives for the goal number 3 is to eradicate malaria. Now, we're still a bit off track with achieving this SDG target. to end malaria, and then that of the WHO's global target also to bring malaria incidence and deaths down to 90% by year 2030. So we're still a little bit off track with achieving them. And to achieve these goals timely, the Malaria Committee needs to tackle challenges and needs to tackle the challenges, needs to identify what the challenges are, and it needs to tackle them, and then ultimately we'll be able to eradicate malaria before the projected timelines. We'll go to the next slide now. So progress achieved. A lot of progress has been achieved in the fight for zero malaria worldwide. First, we have increased funding for various interventions. We have funding for these interventions is increasingly higher now compared to before. And then these fundings are being used to implement a lot of malaria control interventions across the world. So they are being used to achieve the zero malaria target. As a result of this funding, more malaria tools are increasingly being implemented. And so far, we have prevented up to 2 billion cases of malaria, and we have also averted up to 12 million number of deaths so far, as in looking at it holistically. We have also utilized the WHO, various policies and recommendations from the WHO on malaria. Some of the policies and recommendations have had to do with the use of artemisinin combination therapies, the use of, recently we have the use of dual active ingredients in mosquito nets. And then we have a lot of other recommendations for the intermittent preventive treatment in pregnancy, in infants, and a lot of other policy recommendations that are all helping to impact this target for elimination positively. The malaria community also have 2 vaccines now as an achievement, as a very good progress recently. We have 2 malaria vaccines to prevent malaria in children. The first one is the RTSS vaccine that was recommended in year 2021, and it is now successfully in use. It has reduced early childhood death by about 10 to 13% in Ghana, in Kenya, and in Malawi. That's the 3 countries where the vaccines were first tested. They are still being tested now. They've not taken them away from those countries. So we already have a lot of good results coming in already from that first trial with the vaccines. And then we've also had reports that in this period when this vaccine was used, there were reports that the number of hospitalizations for severe malaria treatment was also reduced. So severe malaria hospitalization was reduced, a number of early childhood death was also reduced because of the positive impact of these vaccines already. Then more recently, last year, the WHO also recommended a second vaccine, that is the R21 matrix M. So we now have 2 vaccines, one already in use. And then it's our hope that with the second addition now, vaccine supply is going to be improved, and more children in the affected countries will benefit. Seasonal malaria chemo prevention. I think that's on the next slide. Those are on the next slide. Yes, seasonal malaria prevention was also scaled up for children. That's part of the successes we've achieved in the malaria control efforts. So this was particularly done for children that are at high risk of severe malaria. So they are treated seasonally. I think it's monthly, they are treated monthly to help avoid or prevent malaria cases as much as possible during those very high risk period, mostly during the rainy season actually. So they receive the treatment they receive is sulfadozine, pyrimethamine, and then amodiaquine. So they receive this treatment and it's really helping to reduce number of malaria cases and deaths in those children. So the strategy is also a very, very good one, and it's a good progress. Then another progress that was achieved is the WHO and the rollback malaria strategy to catalyze a high burden to high impact approach that intensifies efforts for high burden countries to achieve the global aim for zero malaria target 2. So they catalyze that strategy, the high burden to high impact approach, to increase efforts in those countries that are still reporting the highest burden of malaria worldwide. Then another progress achieved was the adoption of the global target strategy, the GTS target. So it was a big progress, and this strategy was also updated, and it is currently guiding all the efforts that we are now using to record successes, including the progressive shrinking of the malaria map. So more and more countries are now eliminating malaria, and the number of countries that are now still endemic are much less. They are getting lesser and lesser. So the map is really shrinking, all due to these efforts and as part of the progress that has been achieved. So next slide, please. Malaria elimination certification. Many countries with a low burden of malaria are reporting fewer cases, like I said, and this shows that achieving the universal elimination and eventual eradication of malaria is possible and within reach. So between year 2000 and 2023, 25 countries achieved 3 years of zero indigenous cases in their countries. That is the achieved malaria elimination. That's what it means. When they achieve zero indigenous cases, that means elimination has been achieved in those countries. And for some years, WHO set it for 3 years. So when they achieve it for 3 years, that means they are awarded the certification. So the most recent country that achieved that milestone was Azerbaijan, Tajikistan, and Belize. And then globally, between 1955 and year 2003, 42 countries and territories successfully eliminated malaria and are now preventing reintroduction in their countries. So like I said, the malaria, the map is shrinking, is progressively shrinking. The malaria map is shrinking. We're having very encouraging results. So next slide. Yes, challenges. Okay, so successful zero malaria target is faced with a number of challenges. Challenges that can be in the form of technical, operational, and financial challenges. So successfully eliminating malaria is faced with a lot of challenges. So we'll just discuss a few of them, some of them. So first of all, I'd like to point out that majority of people who are affected by malaria, they live in the poorest countries, they live in resource-poor countries. And these countries have limited access to basic healthcare. So these people, they have difficulty accessing quality healthcare, especially in time to save lives from malaria. They also have difficulty accessing the other required tools needed to combat malaria, such as the artemisinin combination treatment, such as the insecticide treated nets. They still have difficulties having access to these tools. So with this very limited access to these tools, the malaria tends to thrive in these resource-poor countries. So malaria thrives and in those settings, and then in turn, the global burden continues to rise. So having these countries unable to, they are vulnerable states, affecting the people from being able to access timely treatments that are available, contributes to increasing the burden, the number of cases that we have. And that is a big challenge because the malaria burden keeps rising because of these challenges. So another challenge is the health system's constraints to provide timely and high quality service. This is mostly due to inadequate tools. The health systems, most of the time, they don't have enough of these tools, enough of these interventions for diagnosis, for treatment. And then sometimes too, they are understaffed. They don't have enough skilled professionals to handle all the cases coming to them because a lot of people have malaria and they have very limited resources, both human power and the tools they need. So that's a challenge too, the health system constraints. Then they also have implementation challenge. This is mainly due to inadequate leadership to provide on-the-ground support for malaria control. So these challenges, implementation challenges, creates the problem for poor delivery of efficacious interventions. So without good leadership for malaria to provide on-the-ground support, we have that these tools, even though they are available, they are not well implemented. They are not, maybe they are not covering, the coverage is poor, and then there is no adequate feedback to know what gaps should be filled immediately so that we can be achieving desired results. So the implementation challenge is really a problem. Then another problem is that of resistance. We have resistance threatening our currently available anti-malaria drugs, resistance threatening our currently available insecticides. And then this resistance problem is also creating an urgent need for more research to discover and develop new active ingredients that can probably replace these ones that are threatened. You know, better drugs, better insecticides, in the event that we lose currently the ones that are threatened, the currently available ones, in the event that we lose them to resistance, so there's that urgent need that resistance is creating for research, for new product development to replace the ones that are threatened. Then we also have inadequate funding and climate change that are also important challenges that are faced in the journey towards malaria elimination. So let's go to the next slide, please. Strategies for zero malaria targets. Malaria elimination programs depend on political commitment. They depend on human and financial resources. They depend on leadership, effective leadership. They depend on the overall health system structure and strength. So all of these factors are very important, and they each play critical roles for successful program. So efforts are increasingly made by the malaria community. Efforts are increasingly made to sustain political will. They are making a lot of efforts to make sure that political will for malaria control is sustained. And then they're also making a number of investments. And these investments are actually increasing now, all towards ending malaria. Then these investments being made by the malaria community is also helping to build stronger health systems. It's also helping to increase the effectiveness of malaria program, the management and the leadership. Is also helping to improve the outcomes from the utilization of these tools and strategies. So overall, we can see that, especially in the number of cases and deaths that are just declining, coming down, you can see the outcomes of these investments when we look at the number of cases coming down, the number of deaths coming down, the number of countries successfully eliminating malaria. So in the next slide, we'll talk about the interventions that are very essential to achieve zero malaria target. The first one is case management. And then the second one is mass drug administration. The fourth one is vector control using insecticide-treated nets, and then vector control using indoor residual spraying. So I will just talk a little bit about each one. So case management entails prompt diagnosis and treatment using rapid diagnostic tests, and also using the artemisinin combination therapies. Of course, there are also other treatments, but these are the the recommended ones that are very commonly used in the healthcare sector. So the aim of case management is to minimize morbidity, that is disease burden, and then to minimize mortality too. So it also aims to reduce transmission. So when patients are properly treated, the mosquito bites the mosquitoes biting them it cannot effectively transmit the parasite anymore, because there is no more plasmodium in their blood to ingest and then go and use to infect the other person. So case management helps to reduce transmission also. It helps to also prevent the emergence of drug resistance, because when cases are well managed, the right drugs are used. So the drugs are not abused, they are used correctly, they are used properly. And then when drugs are used properly, that just reduces the likelihood of drug resistance. It helps to reduce the problem of drug resistance. So case management is very important for our goal. Another essential intervention is mass drug administration. Yes, mass drug administration is mostly employing the use of sulfadoxine pyrimethamine. That is aimed at treating pregnant women who essentially have to be taken care of because their immune systems, like I said earlier, is very low during pregnancy, especially during the first and second pregnancies. So their immune systems are really low and they are very prone to malaria attacks. So they need these treatments to help improve the outcomes of their pregnancies, to help reduce the risk of having babies with low birth weight, the risk of having anemia, and sometimes even premature birth. So mass drug administration is a very essential intervention to achieve a WHO target for malaria elimination. Then another strategy is yes, the vector control using the insecticide-treated net and the indoor residual spraying. These are also very highly effective ways to reduce transmission, because with the mosquito nets, the mosquitoes cannot have access to bite at night when people are sleeping under the net. So mosquitoes can have access to bite, and then so you're already interrupting transmission. And then with the indoor residual spraying technique, when homes are sprayed with these chemicals, the mosquitoes that are there at that time are killed immediately, and then anyone coming in after some time, because there's a residual effect, they also die off. So that's altogether, put together, that also interrupts transmission or reduces transmission. So all of these tools, we have data, we have statistics showing that these tools are being deployed to endemic countries. We see reports of the number of these tools that are delivered to us by the manufacturers. We see reports of the numbers that are deployed to different regions where they are needed, but we don't really see as much reports of how they are utilized, the number on their utilization. That is a big question we need to address. We need to make sure that these tools, because they're very essential, they're very important, we need to make sure that these tools are actually getting to where they are needed. That is the target population they were designed for, and we need to make sure they are being properly used. So we need a system to be able to track these things, to be able to track and know about their utilization. Next slide, please. Yes, no, the other one, this one. Okay. Yes, successful gains towards the zero malaria target have been made possible by global teams with a common goal, common motivation for a malaria-free world. Personally, I think that the best opportunity we have for malaria is the many dedicated teams we have across the world working together and taking a lot of important actions to achieve this goal. We have the WHO through the Global Malaria Program. We have the national malaria control and elimination programs in different countries. We have the health professionals, we have funding bodies, very many of them. We have the policymakers, we have the regulatory authorities, we have the scientific communities, including the scientists. We have malaria advocacy groups. We have community members. We have many stakeholders in the malaria community. We have a lot of people all together working together to end malaria. And so, like I said, personally, whenever I see breakthroughs and even new accomplishments achieved towards the malaria goals, my thoughts are sometimes mostly centered on this network of very resilient teams that worked for those successes that I see, those accomplishments. I think about these people that all work together. So, for instance, recently, like I talked about in the other slide, we achieved the success with vaccines. We didn't have vaccines before, and now we don't just have one, we have two. So when I saw all that, I was just thinking, this is because of this team, this is because of these people who kept working together till success was achieved. So I think that with this team, with this very highly motivated team, we will meet all the challenges, we will overcome all the threats, and we will ultimately eradicate malaria in the nearest future. Next slide, please. Okay. Strong health system for malaria. Okay, the WHO technical strategy for malaria recommends that national strategic plans consider health systems readiness to expand malaria programs. So this means that there is need for us to strengthen the health system. There is need for a stronger health system. So a stronger health system will be able to help to sustain delivery of malaria treatment. It will help to provide point of care rapid diagnostic tests at the health centers, the hospitals, the clinics. It will help to improve, it will have to also provide insecticides. So a strong health system will also help to sustain efforts for malaria interventions, to be able to remain in place even when cases fall to zero. So when the health systems are stronger, even after we've achieved elimination, these interventions will still be there because we can't tell really what, in case of any eventualities, any emergencies, these interventions, a stronger health system will help us to make sure that these controlled interventions are still in place even after zero malaria is achieved. So a stronger health system will also help us to ensure that countries are able to better respond to emergencies, like the pandemic, the COVID-19 pandemic we had. That was an example that highlighted how much we need our health systems to perform better. So a strong health system will also help for malaria. Then we also need to support the health systems in order to be able to, okay, I talked about how the COVID-19 was impacted malaria, and how that is a reason why we should also strengthen our health systems. So health systems need to be supported in general. We need to support the workforce. We need to support their health system. We need to support their leadership. We need to support their facilities. We need to support their equipment. We need to support their technologies, their products, their medical products. We need to support them in their finance and logistics. So they need to be strengthened for malaria. Then next slide. Okay, strong leadership for malaria. For the zero malaria goals, we also need to strengthen leadership to solve practical implementation problems for malaria. Stronger leadership for malaria will help to ensure effectiveness at all levels, whether it's at the national level, whether it's at the regional or at the country levels. We need leadership that will help ensure effectiveness. We also need leadership that will be able to raise awareness and encourage communities, encourage stakeholders to engage in interventions that are on ground. So we need stronger leadership for these things. We also need stronger leadership for malaria to be able to improve the activity, as in activity planning, the activity planning for malaria, the to-dos, the daily, day-to-day plans for what should be done towards malaria control. We need strong leadership for that. We need strong leadership that will be able to deliver the interventions that will be able to deliver the interventions, the strategies to the people that they are the target population, to deliver them to the target population, the people that these interventions were actually designed for. We need a good leadership, or a stronger leadership rather, to be able to deliver these interventions according to the needs for which they were made available. Then we need stronger leadership for malaria to provide effective communication and motivation, especially to the target population, like I said. So a good leadership should also be able to provide communication, and it should be able to motivate the people that have to utilize these interventions, the people that have to implement them. They all need to be, there needs to be good communication between everyone involved, and then motivation too. So good leadership or stronger leadership will also help to positively change the knowledge, attitude, behaviors of people who are all working together to achieve malaria elimination, especially in communities where there are a lot of behaviors that encourages malaria to thrive. There are a lot of attitudes that encourages malaria to thrive. And then there's also a gap, a knowledge gap. A lot of people who do not know what malaria is really about, who still do not believe they should use the recommended treatment. They don't think they should use the insecticide-treated nets because they lack the required knowledge, the understanding, the importance for these things. So we need a stronger leadership to be able to handle some of these challenges, to fill in some of these gaps, so that ultimately everyone is working together and we're achieving our goals for zero malaria. A stronger leadership for malaria is also going to help to make decisions on how best to use the malaria, let's say staff, those people who are working together to achieve the staff. Yes, people who are all working together for this goal. Strong leadership is going to help to be able to, make decisions on how best to utilize the people working together, the budget provided for various objectives, the drugs and other resources, that are available to achieve results. So a good leadership is going to help to decide, to know how to make decisions for all of these to work together. Then we have stronger health systems and the leadership playing critical roles for zero malaria goals. Let's talk about this one in the next slide. Yes, there are critical roles. There are some critical roles that stronger health systems and leadership are going to play for malaria. So I'll mention some of them. One of them is that some of the critical roles, and one of them is that it will ensure robust health system response in a number of ways. It will help to identify the population at risk. It will help to accurately diagnose and treat patients. They will help to provide effective treatment and preventive measures. So some of the roles they will play are very critical, and so it also buttresses to the point why they should be strengthened, why they should be improved, why they should be supported. Then another critical role is that a stronger health system will also help to ensure delivery of affordable malaria commodities, including the insecticide-treated nets, the rapid diagnostic tests, the artemisinin combination treatments, and vaccines. So it will play a role in that too. And then it will also play a role to manage the threats from resistance, the threats to the drugs and then the insecticides due to resistance. Stronger health system will play a critical role to help manage that. Then a stronger health system will also help to facilitate research, education, and training. They can help to their research can help to improve the existing tools and strategies we have. Their research can help to create new tools for malaria. Their research can help to provide evidences for better decisions. It can help to disseminate information and increase awareness of malaria. Then funding, let's talk about funding now. A stronger health system will also, and even leadership together, both of them can play a role to advocate for increased funding for malaria. They can play a role to advocate for funding, because funding is needed across all sectors in the malaria control. So both leadership and the health systems can be responsible for that. They will play very critical roles for that. Next slide. Okay, so they will also play a role to implement malaria surveillance system for overall program performance. A stronger health system and leadership are also needed to be able to monitor the implementation of national malaria strategic plans and policies in endemic countries. It will also be able to, it will also help to sustain political commitment and collaborations. Then also stronger, it will help to deepen collaborations. Then stronger leadership is also important because it's going to help to better mobilize people for the required partnerships. For instance, the non-governmental organizations that can also play very good roles. A stronger leadership can help to mobilize them. It can help even the private sector that we also need to participate, because we need all hands on deck for malaria to be able to achieve these goals. So we need stronger leadership that can help to mobilize for the partnerships, mobilize for all the participations from the various groups, like the non-governmental organizations, the private sector that I just mentioned. So next slide. Community engagement. So community engagement and participation are also very critical for disease control. And this is because local knowledge and relationships contribute to make programs more sustainable and properly aligned with the local context. Also, working as partners in the communities will improve teamwork, and it will increase the quality of community members, the feedback from them. And this feedback is actually very, very necessary to be able to know how to, especially for wider coverage, to be able to cover, to achieve the required coverage. We need feedback. We need to know what's going on. We need to know what to do immediately to fix problems so that we can achieve our goals. So community engagement is very important. It addresses some of these issues. Next slide, please. Conclusion and recommendation. So this presentation highlighted the importance of strengthening health systems and leadership that are tasked with fighting malaria. And overall, I still think that emphasis remains on building a stronger health system that will be sustainable. Emphasis remains on providing leadership strategies to improve the uptake and use of malaria interventions. Emphasis remains on providing homegrown and lasting solutions to the problems. Emphasis remains on a need for collaborating closely, especially with the stakeholders. So these are some areas I think that we need emphasis on. But this presentation overall has actually emphasized the need for building stronger health systems and the need for providing a stronger leadership for malaria goals to be achieved. Thank you all for listening.
Thank you so much, Rachel. It was a very, very informative and a very insightful session. And I'm sure that very few of us had this information, and you have really highlighted some of the key things, such as what is the WHO vision, what are the milestones and the targets that have been set for upcoming years, and what are the ways that these entities are working for global elimination, and what is the progress that has been made so far, which is tremendous and I mean commendable, and what are the different strategies that are being used. So thank you so much for this informative session. Now we will start with the question and answer. Okay. Um, so let me tell you that the certificate for this webinar will not be paid. It's a free webinar, so you will be getting your certificate in your through your emails. So kindly take a look in your inboxes. Okay, so Rachel, can we take a first question?
Okay.
Yeah. So Perelimi Sagoi asks, is it true that there is a male mosquito that causes malaria?
No, the male mosquitoes do not cause malaria. They are just, they cause nuisance, they just bite, but they don't transmit malaria at all. It's only the female Anopheles mosquitoes that cause malaria.
Okay, thank you. Then Lebohang Lebo asks that a person diagnosed with malaria will be healed by which drugs? Because I saw where they said that purchasing of drugs is a major issue. So can you throw some light on this question?
Okay, some of you, if I heard you correctly, you said you want to know the drugs used for treating malaria.
Yes.
Okay, so the WHO actually recommended the use of artemisinin combination treatment. That is the drug that is used to treat malaria. That's the main drug for malaria treatment. However, there are also other drugs that are used. There is chloroquine that are still in use in some settings. There is Amodia queen. Although we don't use these drugs. It's not encouraged to use these drugs as monotherapies anymore. We don't use them as single drugs. We prefer to use them now in combination. That is because of the problem of resistance, drug resistance. So the recommended drug is the artemisinin combination treatment.
Okay, thank you. Brian Matheka asks, I'm not sure if he wants to say when is the malaria vaccine administered. I'm not sure if he wants to ask when or where. So where is the malaria vaccine administered?
Where
Is
is
there
it
a specific
administered?
location? Yeah.
Okay, right now the vaccine has been deployed in only 3 countries, and then in those 3 countries where they're actually just for children. The vaccines are only for children, not for adults. So the vaccines are injectable. So it's injections. So they go to the clinics, they take the children to the clinics, and then they are injected the vaccines in different doses. So they have to go back. I think it's about four different doses thereabout. So the children have to complete the doses as scheduled.
Okay. Ilsa Nadim asks, are mosquitoes with Plasmodium everywhere.
Sorry, please let me hear that again.
Are mosquitoes with Plasmodium everywhere?
Okay, mosquitoes with plasmodium everywhere. No, that would be no, because if there will be some countries where there is no malaria and they have this mosquito species, Anopheles mosquitoes. So in those countries, because they don't have malaria, they don't have people who have malaria, the mosquitoes will not have where to pick up the parasites to transmit. So it will just be there. It will find other, it will just be there. It will not just transmit malaria, but they will have the mosquito species, but they're not transmitting malaria. So the mosquito can only transmit malaria when there are people who have the parasite in their bloodstreams, and then the mosquitoes bite them and pick up the parasites. So when those people are not there, the mosquitoes cannot have malaria. I cannot have plasmodium in them.
Okay, that was very informative. Kumbirai Bako asks, how do we deal with the issue of climate change in eliminating malaria?
Okay, climate change and malaria. That's a good question. Thank you. So yes, we've all heard about climate change and all the problems. And of course, it also impacts malaria. Climate change, malaria is a climate sensitive disease. It's sensitive to climate because malaria is affected by temperature, is affected by humidity, and all of these is affected by climate. So we know so far that because malaria is sensitive to climate, it can affect the transmission levels. So the climate can impact the mosquitoes and the parasites, so that at the end of the day we have some effects on transmission rates. We have some effects on seasonal treatment, because a lot of people who are burdened by malaria, they are scheduled for seasonal treatment. They have seasonal chemotherapy and preventive treatment. So if climate is affecting malaria, you find out that those interventions, those timing when they have to take these drugs is going to be impacted. So these interventions, malaria interventions that they need very critically, is going to be impacted, and ultimately that is going to impact the overall control strategy for malaria.
Okay, very informative. Thank you. Kashif Ullah Khan wants to know, how does leadership play a role in this case?
Leadership, how does it play a role? Well, we talked about a lot of that in the presentation. Leadership plays a role, especially I would just highlight in communities, for instance. Leadership is going to help to do a lot of coordination, a lot of advocacy, is going to help to do a lot of behavior change communication, so that some of the behaviors, some of the attitudes that encourages malaria to thrive should be interrupted, should be avoided. And then leadership is going to have to play a role in advocating for the interventions needed to address malaria, the tools, the strategies, the funding. Leadership is going to play a role in making sure that we have a good surveillance system in place for malaria, a good reporting mechanism, monitoring and reporting system in place for malaria. Leadership is going to play a lot of roles, critical ones for malaria elimination.
Okay, so Edmundo wants to know, if does the eradication of malaria necessarily mean that elimination of all mosquitoes?
Elimination of, sorry, I didn't get that part.
Does the eradication of malaria necessarily mean the elimination of all mosquitoes?
No, not all mosquitoes, not all mosquitoes, just the ones that transmit malaria, the female Anopheles mosquitoes, not all mosquitoes.
Okay. One of the anonymous attendee wants to know, does malaria affects the baby during pregnancy?
Yes, a lot. Malaria affects the baby during pregnancy a lot. It like I said, the pregnant women, when they are pregnant, their immune system is low. So because of that, they are easily prone to malaria. And when they have malaria and they are sick, that affects the baby's development. It can cause stunted development in the baby. Then there's going to be anemia that's going to affect the baby. It can cause preterm delivery, so the baby can be delivered before the due date. It can cause a low birth weight. Even when the baby is born, the baby can be the weight can be less than what the standard weight of a baby as expected. So yes, malaria affects
Lot of
the
complications. Okay. There is an anonymous attendee who wants to know, there is a myth drinking a little amount of alcohol can cure prevent malaria. Is it true?
alcohol to prevent malaria.
Mhm.
Oh, okay. Okay. I don't really know that for sure, but what I understand, what I know a little bit of, is that treatment of malaria in a lot of these endemic countries have really been with a lot of natural products. They treat malaria with a lot of natural products, mostly from plant-based products. So the way they prepare these plants, which science has proven that some of them are actually they have anti-malaria properties, some of these plants. Now, the way these locals prepare their plants vary a lot. Some of them use a lot of alcohol to extract the plants. Some of them can use water to extract the plants. So different people just prepare the plants in very many different ways. And so when you take that, for instance, you've taken the preparations that was made using alcohol. So we can't really tell which one exactly cured the malaria. Was it the plants or was it the alcohol? We
Alcohol.
can't be sure. So that's why we need a lot of science to tell us
Yeah.
these things.
Okay, we are taking the last question here. Shelmit Mukumbu asked, how effective has the vaccine been in the countries that are already administering it?
I'm so sorry. I didn't hear that. Can you tell me
How
that?
effective has the vaccine been in the countries that are already administering it?
Oh yes, the vaccine had proven to be very successful. Like I said in my presentation, they recorded up to 13% reduction in number of deaths that were prevented because of the vaccine, up to 13%. And then they've also recorded that hospitalization because of severe malaria was reduced. So fewer number of children were hospitalized for severe malaria, and 13% of children who had gotten their treatment were able to, they prevented mortality. So they didn't have as much mortality as they would have without the vaccines. So the vaccines have reduced the number of deaths, it has reduced the number of hospitalization in those children that were treated.
Okay, great. Thank you. Rachel, I think this is a very important question which I don't want to skip because this is especially a very important piece of information for places where there is a challenge of getting drugs. So Anjali BK asks, is there any place where we can get anti-malaria drugs free of cost? So are there any hospitals or maybe medical facilities or government sponsored you can help with that they provide malaria drugs free of cost?
Yes, you're right. That's actually a very important question. And the
Yeah.
answer is yes. Yes, there are a lot of places where you can get this treatment free of charge. A lot of places where they are free, and they are most of these treatment, like the mass drug administrations, they are not paid for, they are free. And then the artemisinin treatment, okay, yeah, maybe you may not get that a lot free. You get that in the hospitals because you can't really give that freely. You need to diagnose and know what's wrong before you begin to administer artemisinin drugs, and want to be careful with how we administer it to avoid to help control the resistance. So, but there are a lot of drugs that are free, they're freely available. And then even the ones that are not freely available, they are the cost, they're subsidized. So people have all these, like the insecticide treated nets. Some people buy them, but a lot of people get them for free. So some of these interventions in a lot of places are free, just that the coverage is not it's not maybe not it's not covering every the entire population targeted.
Okay. Well, thank you so much, Rachel. It was a wonderful session and a very, very informative session. And again, thank you so much, all the attendees who are here to listen to Rachel, the information she shared. And I believe that all of us will take this advice from her. Let's keep our surroundings clean and let's make our country malaria free as far as quick as possible. And we as responsible citizens, let us take that onus and be responsible individuals. And I once again thank you so much. If you are interested in any of our courses, please log on to www.uniathena.com. We have number of courses in different areas of management, IT, healthcare, public administration. Many courses are available, and the you can take these courses as per your modules. They are flexible learning is available for you. So I would request all of you to go to our website and check the courses over there, and we would be more than happy to help you, and we would like you to be our learners and looking forward for that. Once again, thank you for this informative session. Thank you, Rachel.
Thank you so much. Thank you so much. I'm happy to be here. Thank you.
Thank you. Thank you. Thank you.